Hello everyone, my name is Anne and I am a McGill medical student coordinating the 2020 Interprofessional Global Health Course. Today my colleague Lucille and I will be describing an interprofessional approach to global health education during the COVID-19 pandemic. Since 2007, IPGHC is a student-led initiative enhancing McGill's global health curricula. In the last cycle, we had various presenters and interactive interprofessional activities on different global health themes. Of 99 undergraduate and graduate students in the course, 81 completed the pre- and post-course surveys. Mean result scores between the pre- and post-course survey increased positively for knowledge topics, including the social determinants of health and sexual violence in relation to global health. A highly significant positive change in student viewpoints was also observed, especially in regards to examining their understanding of the roles and responsibilities of other healthcare professionals and to the importance of global health education for healthcare practitioners. These 81 students from over 20 disciplines also wrote a final reflective essay, which allowed us to assess how knowledge gained in IPGHC was applied to the COVID-19 crisis. Several recurring themes were identified, such as policy and politics and access to healthcare and resources. Reflections indicated that higher mental health crises, financial implications, and exposure to COVID-19 are inequities to be seen throughout the pandemic. Students further linked the urgency of One Health and planetary health concepts to the current situation. As one student said, effective action to reduce emissions must be planned and sustained over time and must consider the impacts on vulnerable populations. Increased funding for the World Health Organization, notification of new viruses like COVID-19, and consistency in travel restrictions and regulations were actions many students agreed could help in future courses.
We proposed 3 recommendations based on this year's course that were highlighted in the literature. The first being to recruit more international speakers and students outside the global north and establish sustainable international partnerships between educational institutions around the world in order to include as many perspectives as possible when it comes to equity and global health issues, and to encourage students to reflect on their individual roles in the global health field in general and evaluate how they can empower, elevate, and collaborate with partner countries to advance health equity as a whole. The second recommendation being to really maximize the utilization of the digital platform using a hybrid model, so both synchronous and asynchronous delivery to promote collaboration, knowledge transfer, and professional exchange among learners of different professions. And the final recommendation to be fostering genuine interest in global health by encouraging students to critically analyze global health issues and to think outside the box in questioning how current systems undermine our concern for social justice issues. And so in conclusion, the Interprofessional Global Health course not only highlights the necessity of global health curricula, but also demonstrates how rapidly learners can apply their knowledge to evolving contexts like what has occurred during the COVID-19 pandemic. Thank you so much, and we look forward to taking your questions.